All right then. Hello everyone. Thank you for having me. I wish I could be there with you. Unfortunately, I couldn't. So this is obviously a tape recording. I hope that it still will provide some value for you. I am Christopher Schmitz. I am a clinician, and I am kind of the coordinator of a Danish organization that tries to reach out to anyone, any person, any family who is in a situation where addiction is a problem, and we're dealing especially with cannabis addiction. This organization provides treatment, conferences, and also educations. We are educating counselors who can provide treatment, and treatment is not just treatment. As you know, there's good treatment that actually works, and there's treatment that seems to work but doesn't really do the job. I'm not gonna discuss whether we present a solution treatment model that works. We have said in all modesty, evidence to back it up. We are using the HAP, Hasoveringsprogram, HAP method, Swedish model, and that's what we've been doing over the last 10 years, educating past 600 clinicians or counselors up to this point. Right. So we're going to talk about Danish drug policy, and let me just give you a super brief, short presentation here of who is in front of you. So besides leading this organization, I have my own practice. I work as a clinician. So people with addiction, cannabis addiction, comes to this place, and we have some consultants working here and placed around the country in Denmark, actually, to kind of help people wherever they are based, wherever they live in the country. I've been writing some books, had some spare time, and thought, why not write some books? The first one, To If I Left, is really a how-to guide to parents and how they can help their young people out of cannabis addiction. The book in the forefront is the latest book, which was published 2020, and it's a modest title, but at least it's what I perceive is what you need to know about cannabis. It works as a workbook for the education of counselors as well. Right. Let me just throw in a disclaimer, because it would only be fair to let you know where I'm coming from, so to speak. And as it says here, I haven't formed an opinion on whether cannabis should be legalized or not. I read the evidence that's available to everyone. So that's what I'm going to present to you today, evidence. And of course, I'm backing up a bit. I'm starting with overview, so to speak, of the cannabis Danish drug policy, especially cannabis history up to this point. And then we're going to take a deep dive in the favorite arguments from the pro-legalization movement. And I'm going to try to deconstruct the arguments and see behind them, and hopefully find out what is really going on. Okay, then. Right. Let's just have a agenda here. So again, Danish drug policy. I'm going to start off with, as I said, an overview historically, what's been going on with the Danish drug policy. I call it the never-ending story, and I'll take you up to this point today. So the story so far. And as I said, we're going to look at the favorite arguments of the pro-legalization movement. It seems that there are three arguments, three pillars that they are, so to speak, shouting from, the core arguments of why we should legalize. Right. When we're done with that, I'm gonna try to look into the future, what's next, what's to be expected, and obviously I wouldn't know, but I have some ideas, and I'll share them with you when we get to that point. And finally, a Q&A. I'm aware that there will be a Q&A, but I have an idea on how we can continue the discussion. And of course, if you have any questions to the presentation today or to me, any questions at all, how you can get them across to my end, and hopefully we can engage in this ongoing conversation. Okay. Just to turn your attention to, and you might want to do that from time to time whenever I change the slide, to the far right, there's a citation up there. It says, at the moment, the Nordic countries are taking seemingly invisible yet rhetorical steps towards legalization of cannabis. So mind you, this is not just going on in Denmark. This is going on across the Nordic countries. This legalization movement pushing to get legalization of cannabis. So, of course, I'm going to zoom in on Denmark, but just to let you know, this is and really, it's not just the Nordic countries, it's, as we've seen, all over the world. Right. So, a historical overview. Let me just give you some pointers here in what I'm going to say in just a minute. Is it legal? Well, I'll let you in on that. I guess you know it already, but it's kind of the assumption, right? When tourists come into Denmark, or I or some of my colleagues travel abroad, people assume right away that it's legal. And that might have to do with an easy access point. You already know what that is, but I'm going to talk about it, of course. Proposals. There's been several proposals from the politicians over the years. I'll just take you some of those. I'm not going to go into details of the proposals. I'm just going to mention them, and we'll move on to where we are today. When we're talking drug policy, we need to address medical cannabis as well. And we need to talk about decriminalization and the latest initiative from the pro-legalization movement, treatment instead of fines. Move your attention to the right side of your screen, please. Again, all the while we're discussing legalization, there are young people who need help to get out of cannabis addiction. So there's a lot of guessing, I should say, on both sides. And it's kind of an academic discussion, and it satisfies some of us, but really we have a job to do. I normally say we already got the problem. We have a lot of young kids who are suffering from cannabis addiction. Why don't we just put the discussion on legalization, or which drug policy should be the right one, and attend the people in need. But again, this discussion, and maybe for good reasons, going on, and we need to participate, of course. Right. So I'm going to turn my attention to a manuscript because I prepared, and I want to do this right, and I don't want to miss any details. So in this historical overview, which is fairly quick done, I'll just give you some pointers. As I said, and then I will kind of get rid of the manuscript and freestyle a bit, but be concrete when it comes to evidence, because after this historical overview, we are going to look, as I said, about on the pillars, the arguments of the pro-legalization movement. Right. So let me just get on here. So cannabis continues to be a theme in the public debate, and for good reasons. The many aspects of this sedative substance seems to be on everyone's lips, especially when a new study from the science emerges or whenever politicians suggest changing policies. We need to address this widely popular substance and get clear on every aspect, from adverse health effects to implications on the youth if policies are changed. When we look at Denmark, really, you can't say Denmark and cannabis without saying Pusher Street, without saying Christiania. We are known worldwide for this phenomena called Christiania. And it seems like you can go right into Christiania, which is a part of the capital in the middle of the town, and buy cannabis without anyone asking, without anyone really doing anything. And it lets visitors to believe that cannabis is legal, can be legally bought in Denmark. And it can't. I mean, it's illegal in every sense of the word, but it's actually happening. This place in town, this Christiania, provides an easily access point for young people to try cannabis. And Christiania has been the center of the legalization debate in Denmark, but more importantly, the problem when it comes to communicate the harmful effects of the youth. I mean, if you can just get off the train and go into a certain part of town and buy cannabis, I guess you would think as a young person that it might not be legal, but it's perfectly okay. And from there to concluding that it's harmless is not really far. So the logic seems to be exactly that cannabis can't be harmful when it's sold on the street in a place that historically, at least, is associated with peace and love. Understanding cannabis through that lens might explain that the fact that 95% of the young people under 18 years new in treatment indicates that cannabis is their main substance and thereby reason for seeking treatment. So this easy access point for the youth to try out cannabis has grown to be the epicenter of illegal cannabis activity, with following shootings and killings. Currently, recreational cannabis use and possession are not legally regulated. Also, the production, import, export, and buying and selling of cannabis are legal in Denmark. However, the debate on legalization has been strongly apparent in media and politics over the years. The public, the media, the politicians seem to be increasingly leaning to the legalization of recreational cannabis. In January 2018, 5 of the 9 national parliamentary parties showed their support for a state-controlled legalization scheme. During that time, the majority within the Danish parliament opposed legalization and decriminalization. However, several cities and municipalities have been openly in favor of the legalization of recreational cannabis. For example, the city of Copenhagen has sent several proposals over the years. All of these proposals have been rejected until now. Even though recreational legalization has not gained the needed political support yet, the parliament unanimously voted for a 4-year trial on medical cannabis in December 2017. See, the trial did face opposition from Danish doctors due to the lack of beneficial medical evidence. However, the Patients Association and the cannabis industry, wish for the trial to become permanent or extended after its official end date, December 2021. And so it have. By January 2022, the trial has been extended. With Copenhagen continuing to push for legalization, the current variability of medical cannabis, and the positive media outlet, the discussion and the lobbying is still very much alive. So where are the public in this? Well, the numbers are a bit misguiding and misleading. Let me give you a peek on that. So in 2019, 39% of the Danish population were in favor of a legalization of cannabis. 40% were against. That picture changed by 2022. Now, 45% of the Danish population were in favor of a legalization of cannabis. 28% were against. What is really interesting here is how we ask the question. So people in favor of the legalization in the 2022 opinion poll was answered yes to the question, do you think cannabis should be legalized and the state responsible for its sale? So that was how the question was formulated in the opinion poll of 2022. In 2019, in that opinion poll, the population was asked, do you mostly agree or completely agree, or mostly disagree or completely disagree that cannabis should be legalized? Let's be clear. The public opinion aside, and how different forms of asking basically the same question misleads us. This, the legalization question, is a Copenhagen agenda. As mentioned several times, the former mayor in Copenhagen has pushed for legalization of cannabis, and there's a good reason for that. Copenhagen must deal with shootings in the streets due to past political irresponsibility. Christiania, as I mentioned, once a social experiment with happy people singing Kumbaya, is today a place in the middle of our capital where you literally can buy cannabis on the street without no one asking questions, but where you need to keep your head low due to frequent shootings. The latest initiative from the politicians is a decriminalization model, and in September this year, they proposed a treatment instead of fines. One problem, though, treatment doesn't work. As I have documented in my latest book, barely 1 in 2 is helped quit addiction. The rest drop out before the treatment is completed. Regardless, politicians' talk of decriminalization and legalization moves young people's focus away from the risk of consuming cannabis. What is even worse, the politicians' arguments are based on a falsity. Right. So let me introduce you to these pillars of arguments. See, before we get them up on the screen here, let me just please guide your attention to the right side of your screen again. People do not form attitudes based on good arguments. They form attitudes based on emotions and ideologies. Then they activate their ability to understand, to justify those attitudes. So I've come across these arguments again and again, and it's really interesting. I guess that's how the human psyche works. If you have something you really believe in, you keep repeating it and hoping that the opponent will at some point give into the arguments. And there's some good arguments out there, obviously, on both sides, but we don't really know how good they are unless we question them. And that's what I'm presenting to you now. I've tried to identify as I said, fairly easy, these favorite arguments of the pro-legalization movement and deconstruct them, look, so to speak, behind the scene, what is really going on. And I've, of course, brought some references, some studies to give us a kind of an idea of what is really going on. So let's get them on the screen here. So first of all, the favorite argument, back to shootings in the street and this really problem that needs to be addressed by the politicians of our capital. We will end organized crime. So that's the first one. Number two, we can better inform young people of the risks. So by legalizing, we will be able to get them into a state-regulated dispensary, and when they come in, we can inform them of the risks. Quite interesting. Whenever I hear that argument, my mind's right away goes to, so let me just understand this. So with one hand, you want to give them something that involves a risk, and you justify that by telling them about the risk. Anyway, that's just me. It seems a little contradictory. The third one, it will not mean more smokers. So by legalizing, we will get rid of the organized crime. We will be able to inform the young people of the risk smoking cannabis. And by doing all of that, we will not have more smokers. A person like me working as a clinician will not see more people in my practice. Let's dive into that and see how it really is. So getting rid of organized crime sounds nice, but if we look especially to the States, to the US, the illegal market is actually growing. Informing people, well, again, it sounds good, but it's not really what's going on. Risk perception is decreasing, and you might say because of that, use is increasing. More smokers or not? Well, experiences with legalization, again, I'm looking to US, shows increased consumption. Right, let me bring up some studies to back this up. So the first claim or argument pillar, whatever we want to call it, is that we will end organized crime. So pro-legalization advocates often argue that legalization will reduce overall crime. Well, cannabis-related crimes rates have risen at a faster rate in legal states than in states where cannabis was not legalized. Here is a study from Oregon that found that counties in Oregon have experienced an increase in simple assault rate following legalization relative to rates in the 19 non-legalized states. When we talk about the black market, supporters of legalization often assert that the legalization of cannabis would eradicate the black market. Well, legal states have seen increases in their underground market. Here's a study to back that. U.S. states with recreational cannabis use has been legalized, where cannabis has been legalized, have all needed to grapple with the persistence of large black markets in cannabis and to generate substantial resources to countering it. Right. The next claim, argument pillar, we can better inform people of the risk. Well, risk perception, when talking of that, the legalization of cannabis normalizes cannabis and its use, causing the associated risk perception of the drug to decrease, which plays an important role in the increase cannabis use of young people. Just take a look at the blue box on your right again. necessary premise in the debate must be that you are entitled to your own opinion, not to your own facts. And, of course, I'm open to good quality studies, and a number of them, meta studies, reviews that support these arguments put forward by the pro-legalization movement. I haven't seen them, and I'm pretty sure it's not a question of me not looking or not looking specific places. I mean, I participate in different debates in the media and with politicians, and I have yet to see good, strong evidence that these claims hold water. Cato Institute study here that found that all states that have legalized cannabis fall below the average risk perception. Again, this is US. Take a look at this picture here. There's a clear connection between perceived risk and daily use, and we're talking 12th graders here. Third claim, pillar argument, it would not mean more smokers. Increased rates of use among youth. Pro-marijuana cannabis activists often argue that rates of youth use will not increase following legalization. However, data shows that legalization does in fact cause usage rates to increase despite efforts to implement youth-focused prevention campaigns. This study is interesting. It's from the United Nations World Drug Report, so it's broader study, obviously, found that cannabis potency has quadrupled in some parts of the world over the last 2 decades, while the percentage of adolescents who perceive the drug as harmful fell by as much as 40%. This has led to a 22% increase in worldwide drug use since 2010, which drug trafficking organizations have been working to supply. And a couple of studies more, 25% increase in what we call cannabis use disorder among the 12 to 17-year-olds in legal state. Cannabis use disorder is the clinical definition of an addiction, a treatment requiring addiction. Oregon state that legalized 8 years ago now have the highest rate of monthly cannabis use when we talk 12 to 13-year-olds in the country. Right. Here, we're still in the US, and here's the connection when we talk past year use and past month use, respectively, in non-legal states and legal states. And the connection is clear. Even though we're looking at different age groups here, we're seeing the same picture. There's an increased past year use and past month use in states where cannabis is legalized. Right. So what's next? What is to be expected? Well, what we have seen over the years, this substance keeps getting stronger. The potency is rising. I almost would say by each presentation I give, the potency is getting stronger and is still rising. This is not your Woodstock weed. So there's we really need to be concerned about the adverse health effect, which, by the way, is very well documented. The latest book is looking at adverse health effect, and I have collected data from 20 years of studies. And I mean, that's kind of evergreen evidence, and that's the kind of studies we should be looking into, solid studies. And really interesting, I mean, it's an academic discussion whether we should legalize or not. And as I said, we need to have the discussion. We just need to mind that there's people, suffering at this very moment while we are discussing. And of course, the adverse health effect of cannabis doesn't care whether it's legal or not. It's still gonna, have implications, severe implications, cognitive implications for the one using. I hope that your takeaway, among other things, will be the following. The Danish drug policy is uninformed. The arguments for legalization of cannabis are based on a falsity. And finally, the way forward goes through science. There's no way around it. As I said in the citation to the far right, let's start by using what we know and stop guessing on what we don't know. So if I can leave you with one thing, let it be this. Listen to the facts and entertain yourself with philosophical arguments. The opposite does not make us wiser. All right, then. Let me just, and I got it here as well. Let me just lead your attention to this brilliant work. Not that I've been a part of it, I have, but it's we last year we did a conference, Nordic Summit on cannabis, and speaking of solid evidence, we invited, the very best scientists from all over the world to help us understand the evidence of adverse health effect. And we wanted from the get-go to produce something that could help policymakers do the right thing. So this is what we created. This is what we call the White Guide to inform policymakers. And I would love to send it to you. So just reach out and I will send this guide to you. Every politician, everyone involved in this debate should have at least one copy of this White Guide. Right then. But if you think that there's anything I could help with, please reach out and let me know. I will be happy to engage in whatever challenges you're facing and hopefully help the best I can.